Order. The question is that this bill be now read a second time. I call the member for Hasluck.
Mr Deputy Speaker, I rise to speak in support of the Health Insurance Dental Services Bill 2012. I hold my colleague from Hindmarsh in high regard. However, I don't agree with the tenets of some of the points that he makes in terms of the accountability. We have a profession that has been committed to improving the health outcomes of Australians, and it doesn't matter where they work. I know many through various avenues, and I know their commitment is extremely strong. If we take that whole tenet, that if people take taxpayers' money and use it in a way that is not prescribed within legislation or by regulation or by criteria for that funding, then I have no problems with them having to repay it. But I also have issue where we make statements in this chamber that are global in context but are hypocritical in the sense of its applied uniformity across various areas of government. And that ranges from members of this parliament through to the pensioner that was referred to. And of course we all receive people who have issue with the way in which government services are provided and for the way in which they're charged. But in this instance, it is a profession that has been brought into a model in which the administrative requirements are onerous insofar as the workload that they have in the provision of dental treatment. And sometimes it is easy, out of an audit, to take a sledgehammer approach instead of taking an approach that would consider each of the individual aspects that relate to what is perceived rotting of a system. Let me say that the bill that is proposed by the Shadow Minister and the member for Dixon is designed to end the Gillard government's vindictive pursuit of dentists who provided treatment to the neediest Australians under the Chronic Disease Dental Scheme. The bill requires the Minister for Health, in conjunction with such other ministers as may be necessary to redress past and future inequalities that have arisen from the operation of subsection 10.2 of the Health Insurance Dental Services Determination 2007. How often do we hear across the history of legislation where we need to make technical amendments because the intention of the bill was honourable, the implication of and the processes required for the administration of any act has often teething problems. And in those teething problems, mistakes are made. I certainly know from constituents that come in, there are often issues that arise because legislation has not been understood, they have been penalised, they have received a letter from a government agency, and we have advocated through the agency or through the Minister for consideration to be given to those specific issues. And often they are addressed and they are often remedied, except those in circumstances where they have rotted and it is demonstrated that they have rotted. 80% of dentists have not deliberately rotted a system that is providing health care to those who are in need. The member for Hindmarsh mentioned millionaires being recipients. I don't want to enter into a class war. This is about all Australians. This is about accessing services that prevent the onset of chronic conditions because of poor dental health. Have a look inside the mouth of somebody who doesn't access a dentist and you will find the origins of chronic diseases that will cost significantly much more to the health system in the longer term. We find that in those circumstances the impact is far greater, and therefore I would find it fascinating that we pursue this end in terms of government action to claw back 21 million. What they should be doing is looking at each individual case. If there is rorting, then deal with those who rort. Where there is genuine mistake because of an understanding, not a lack of understanding, but an understanding of the processes, then we should give due diligence in consideration to ensure that we keep dentists engaged in the delivery of services to those who have the greatest needs. I often hear ministers in the main chamber talk about battling families, how Labor is committed to providing services to those who have the greatest need. I've heard them criticise the fact that millionaires shouldn't receive funding for some of the programs. But what I'd hate to see is that a dental health service that has every intention of having beneficial outcomes to the health of every Australian is diminished by the fact that we have taken, or government is proposing to take, a sledgehammer approach. Let me say I participated in the whole health reform, and that was about no blame. That was about shifting the blame game and looking at practical approaches to the health needs of Australians, where there is a continuous, seamless flow between each of the sectors in order for health to be provided. The Health Insurance Dental Services Bill would seek an end to the injustice Labor appears determined to inflict upon the nation's dental professionals. The bill will require the Minister to halt demands for repayments and Medicare is issuing, to halt demands for repayment that Medicare is issuing to hundreds of dentists for a technical breach of the law. Dentists are facing demands to repay all Medicare benefits they have received despite having provided full courses of treatment. If I take the proposition by the member for Hindmarsh about rorting, or that a misunderstanding or a lack of knowledge should be applied in this instance, then let me share with you something that I listened to with great interest on a radio station in Western Australia under the BER program, where subcontractors to builders were not receiving their payments. What they discovered when they approached the Commonwealth Department responsible was that the companies had submitted affidavits saying that they had paid their subcontractors when in fact they had not. And let me also say that those agencies are not prepared to follow through with those breaches that are deliberative and are not prepared to tackle an issue that is absolutely wrong and has a stench to it. And yet with dentists, we are prepared to make sure that they repay for services provided. Let me say that if we damage this scheme and damage the capacity for people to access services that will make a difference to their health, then oral and dental infections will increase. People's capacity to access dental services will be problematic. Let me say, if I was one of those dentists affected, I'd be less likely to want to play ball and be part of a Commonwealth program, not trusting a government. Because 85% of dental services are rendered by private dentists who service about 12 million Australians annually. 7 million of the other 10 million are eligible for public dental care, but what is received is approximately 1.5 million occasions of service annually. So we shouldn't diminish the need. We should really, out of an audit, and having been involved with audits, what you do is you go to the crux of the problem and look at the issues. Don't apply a uniform approach that damages. If this government is serious about meeting the needs of the battlers, then don't punish if there are mistakes that are genuine. Work with the individuals, remedy the problem, ensure the continuity of dental care that reduces the long-term impact on the health of individuals. I certainly hope that the Minister will redress what is required, make the technical amendments so that we can have a strong and vibrant program that enables ordinary families, ordinary Australians to access the health care that they need through their dentists and in concert with their GPs, and that the care plans required are a step that, if that is problematic, then it is remedied and they are given the encouragement and support to ensure that that occurs. I support the proposed bill and would hope that government considers the impact of any decision which will be detrimental to all of those who are in need of dental health treatment, and that the approach that they are taking will be reconsidered and that each dentist is considered on a case-by-case basis so that we have a strong, viable program that is provided and accorded to all of those who have a need.